Start video. I've mastered Zoom. Now I have to master WebEx.
WebEx is really similar.
I'm like, where is it? All right, so we have Jean, Cabby, Maureen, and Dr. Mohammed had a meeting at school. He's teaching a class at this time, so is unable to make it. So I don't know if we should discuss that. So we're just waiting for Kathy, right?
Yep. Has anyone heard from her? Is she definitely joining?
I did not hear one way or another.
Okay.
I would probably ask you because you guys are Yaleys, right?
Yeah, I don't ever see her though. I work from home now.
Yep.
Nobody wants us in the building.
This is my area.
This is mine.
Yeah.
With the dog behind me all the time.
I locked mine out because I was like, oh no, we're not going to bark. So.
Well, I'm downstairs in the living room only because this is the most comfortable chair. And they let us take everything from work except our chairs.
Oh, and that's the most comfortable thing.
Right? Yeah. Yep. So I have all these monitors set up at my desk, but I need to buy a new desk chair.
Yep. So
let me see if I can text Kathy, because if she's not going to join, we could get started.
I was just going to say, we'll give her another minute or so, and if not, I was trying to confirm what quorum was for us, but at this point, I don't know that we have anything really to vote on tonight. It's more informational, and so
I think if one person is absent, we still have a quorum, right? I'll have to ask. I'll look it up after I text Kathy. You are joining, because I mean, if one person's absent, then we'll never have a quorum because there'll be a person absent all the time. Just joining our BOH meeting.
Jean, you didn't get stuck in traffic today. You're free.
No, I didn't. And Stephen is here, and he said that you need 3 out of 5 for a quorum.
Okay, so
but out of which 5?
Do I count as the chair?
There's only 1, 2, 3, 4 members, because Maureen's not really a member, right? Like you come as an employee.
Right, I'm not really a member.
The chair counts.
Okay, then it's 3 out of 5. Okay.
Well, we only have 4 members, though, right? Oh, the doctor.
Yes, the doctor.
Correct. I gotta get his name instead of stop calling him the doctor. By the way, Maureen, it's nice to meet you face to face.
Nice to meet you, Cubby. Thank you very much.
I know we've spoken a couple times, but she is. She needs the link. Okay, emailing you now.
Okay.
Are you emailing it to her, Heather?
Well, yeah, I can. Yeah.
Okay.
She's on here. I'll forward this.
What account is it of hers? Just so I can tell her, like her Gmail or her.
I will look to see. Is she KETRRNNP?
Yep.
Yeah, that's it. Oh yeah, that is her. I'm sending it. Forward.
What mail? Is it Gmail?
It's Gmail, yeah.
Okay.
Forward. KET. Yeah,
dog, you can't be on my. You can't be on the wires.
Got it.
Gracious. I saw the email from Kristen with the meeting link, and I'm like, why is Kristen emailing me Board of Ed meeting stuff to my personal email account? And then I was like, oh, it says BOH.
Yeah. BO, wrong last letter.
Too many boards.
Yeah. I actually had a meeting for a kite flying event before this. I was like, I didn't mean to book. I'm sorry, I'm leaving in the middle. Very important kite flying meeting.
Listen, I have a friend that used to work patient relations at Greenwich Hospital, and one day they told him it would be nice if you went outside on the front lawn of the hospital and flew kites for the patients. And he was like, ha! And they were like,
no,
we're
really?
not kidding. Like, and he's like, it's 100 degrees out. Can I take my suit jacket off? They're like, that's not very professional. So he was out there running up and down the
Hey, but it brings smiles.
He said there was no wind. He's running up and down the lawn trying to fly a kite in his suit.
All right. So I can, let's see. So I'm going to start with a pledge after we call to order. I'm sorry. When I do the PTA, sometimes I put a flag up, but I don't even begin to know how to do that on this, but I will call it
Give
to
me 1
order.
second and see if I can do it
She
for you.
gets here. Yeah. Oh, yeah. You got one?
I might.
I do actually have a couple. I'll make sure I keep them handy.
Perfect. Because I was like, I can do it on Zoom, but I'm definitely not comfortable with WebEx.
Okay, hang on. Let me.
Did she say if she got it? I think.
All right, let me know if you could see.
Oh, perfect.
All right, there you go.
Perfect.
There we go.
All right.
She said okay, so I'm assuming she's joining any second, so we can
Okay.
start.
All right. So, can we call to order at 6:37? And we will rise for the Pledge of Allegiance. Please. I pledge allegiance
To the flag
the
of the
United
United
States
States of America
and to
and
the
to the
republic
republic for which it stands,
one
one
nation,
nation, under
under
God,
God,
indivisible, with liberty and justice for all.
And thank you, Kebby, for the flag. I appreciate it.
Welcome.
So if I go to a different screen on it doesn't mess up this WebEx, right? Like,
Oh, as long as you're not sharing your screen, you should be okay.
okay, perfect. Just making sure. Telling you, it took me a while to get Zoom. Now I got to get this. So, just for a roll call, Jean, do you want to call the roll call?
Sure. Does that mean just going through the names?
Yep. Make
Okay.
sure who's here and who isn't.
Okay. Kebby Waterfield.
Present.
Kathy Tucker, did she get on yet?
Not yet.
Not yet. Me, I'm present. Maureen Lewis.
Present.
And Dr. Muhammad is absent. And did I miss anybody?
And me.
Oh,
Heather Shea, I'm here.
The esteemed chair.
I had a cheat sheet because, as I said, I've never done this before, so I just copied what Kristen did last time, and I started writing all the names, but I must have forgot your name. I apologize.
Perfect. No, don't apologize. It's fine.
So if you want a minutes tip, I'm the secretary for the Democratic Town Committee. So first of all, if Mike Last asks you, you know what would be fun? It won't be. Just a tip if you talk to Mike Last.
Just a note.
So when I take minutes for the town committee, I save the previous version before the meeting and I backspace all the data, or I'll use the agenda and I'll type right on the agenda. It's sometimes easier for you to follow. Just a tip if you like to handwrite, that's good too, but I hate to handwrite.
Well, I didn't know how to access the computer and the screen at the same time, so it's all a work in progress.
Gotcha. Whatever you're most comfortable with.
But for PTA, I do the same thing. I use the agenda
Huh?
and then just do the notes from the agenda because
It probably makes sense to do it that way, yeah.
Hello, Mrs. Tucker.
Hello, how are you all?
Happy YNHH Appreciation Week.
Oh, yes.
Aw.
We have a appreciation jar on our unit.
Is that right?
Greg got a sugar cookie today at Bridgeport.
Yeah. No, I'm making the rounds. I got a lot of people to thank. I have to go into the MICU at the end of the week and thank everybody in the MICU too. So.
Well, thank you both, Yale employees.
Same to you guys. We're all in the same boat.
Well, right. I was going to say, I think it's.
Amen. Jean, where are you at?
I work in Smilo on College, North
so you're
Haven.
Yale too.
Oh, you're in North Haven?
Yeah. Divine Street.
Oh, it's nice out there.
It's beautiful there.
I love it there. And
Yeah.
once it comes to our area, nobody ever wants to go anywhere else.
Yeah. And Maureen, how are you?
I'm doing okay.
Maureen is a rock star.
No, we have a lot of rock stars. That the the team of volunteers and staff that have been working on this have been amazing. I just will never be able to say enough and thank anybody properly. Tomorrow is 1 year since I was notified of our first COVID case.
Wow.
And I feel like that's so long ago.
Yeah.
But when you look at what we're doing what we've done since then, being vaccinated, I think it's pretty amazing. And I'm sure as you all, as Yale New Haven Hospital employees, have seen quite a bit.
A bit.
Yeah.
Tomorrow will be 1 year that I have a new knee. One of the last elective surgeries at Yale New Haven Health System.
Congratulations.
Thank God I got right in under the wire. Yeah.
I forgot.
Well, congratulations.
Thank you.
Happy anniversary. Happy anniversary. So I guess, the next thing on the agenda, I will turn it over to Maureen to just give us all kind of a where we are, a state of the city health-wise, I guess, is the.
I'm sorry.
Yeah, sure. First, I do want to say thank you for forming this board and being on this board. We haven't really had a formal board of health in a long time, and I look forward to having you. Your advisement and assistance, especially now as we are busier than ever. And the vaccination effort has really been all-consuming. It's kind of what the main focus is right now. While we still have cases of COVID in the city and around the state, and even variant strains, it is a lot better than it was even a few months ago. So I guess what I'll do, and I shared with Heather, so directors of health have access to a state database, and that's where all our cases and all our infectious disease cases are entered. I didn't share that because of the confidentiality. So what I'm going to use is the state data.ct.gov report, which is the same number, same data as what you'd see in my state database. So since the beginning, since March of 2020, the total number of COVID cases for West Haven are 4,790, with 110 deaths. And testing, 30,331. When you think about our population, right, we're close to 55,000. It's more than half of the people of West Haven have been tested for COVID. We did have a couple of the variant strains, the B117, and normally I get notified. It takes them a while to determine the variant strains and to notify me. And usually when I'm notified, it's after their quarantine period. We do have we had 3, 4, I think 4. We had one recently, but no other strains beside those. Currently, and just so that you know too, I think it's important to know, we have a staff of contact tracers, we have an epidemiologist, and those people were hired with COVID funding that we received from the state and from CDA. And those contact tracers have been busy for a year, calling cases and following up every day until they pass their quarantine period. Back at the end of January, we started vaccinating. And as Heather knows, the process to be approved to vaccinate for COVID-19 is quite a bit of an undertaking. We had to go through a formal process that was very regulated by the CDC to even be approved. And anything we did an application, purchased equipment, everything had to be approved. where we were going to have our site. Our freezer, our refrigerator had to be approved. Everything is approved. And then we had to get access to VAMs and training. So it was kind of a long, it took a good month to get all those approvals. And then we did our first clinic on January 29th. And we did that first clinic in the Emergency Operations Center. And that's really what that's our main vaccination center listed in VAMS, but our clinics have been operating at 201 Noble Street. The EOC is where we receive our vaccine and where we store it. So anytime we move our vaccine, it has to be very carefully packed up and transported in special coolers.
Can I ask you where that is?
I was going to say the same thing.
Sure, say it again.
Where is the EOC?
The EOC is in the basement of City Hall.
Oh,
So it's next door to the DMV.
okay.
Yes. And that's where we keep our medical grade freezer and refrigerator. Moderna is frozen, obviously, and must come out a good 3 hours before we do our first shot. It takes quite a bit to thaw.
Are you vaccinating daily?
We're not, although this week and next we have about 3 clinics a week.
Okay.
We generally have our largest clinic on Fridays at Noble Street.
Okay.
Tomorrow we're doing one for the Board of Education. We're doing one.
Thank you very much. Thank you. Thank you.
You're welcome. It's a pleasure. We're doing one Saturday for their second dose of 65 and over group.
So can I ask
And
how
then-
people know, like, how do people find out about that? Because I saw a post somewhere that there's a lot of people having a hard time getting appointments.
Mhm.
And so is it publicized somewhere? Because actually, this is the first time I've heard about it separate from like going through VAMS through the state of Connecticut.
Yeah, so we have social media. Mike Walsh posts everything on the city website. West Haven Health Department has a Facebook profile,
Okay,
and I can direct you to those.
sure.
But one of the things that VAMS is very difficult. VAMS is not intuitive. It's not user friendly. And so what we've done for our population, 65, 75 and over, is we did a 2-day registration event at the CLO's IA Club.
Okay.
People to actually physically come in, complete paperwork, and register that way. And then we just called them all, and made appointments in a third-party walk-in style.
Can you
And
repeat
that's
the
what
name?
we're taking. Pardon me?
I'm sorry, Maureen. There must be a delay. I'm sorry. I don't mean to interrupt you.
Okay.
Can you repeat the name of the registration site that you used?
We use the IA Club, the Italian American Club, CLO's.
Gotcha.
Yeah. And it is very difficult for people who do not have computers or aren't really savvy or don't have email or don't want to use VAMS. You know, not everyone likes using computer or putting their information into VAMS. So we have not been opening up VAMS to the public. We did it one time. We're doing, you know, it's more labor intensive, but we prefer that we get our community. And that's how we're going to continue to do it. As people call in, we're building another list, and as people 65 and over and 75 and over call in, we add them to the list and schedule them. Now, the latest, Heather and I were talking today, is next weekend we'd like to begin our Homebound vaccination program. And that's, you know, the list we have at the moment is about 17, 18 people, but I know for sure there are far more people out there that need vaccine that can't get to us. And so therein lies the dilemma. How do we find them?
So, Maureen,
Oh, sorry. Go ahead, Kathy.
I'm sorry. I don't even know who I was interrupting again. I'm sorry.
It's okay.
There is a delay.
The question I guess I have is, do you have demographic information? Do you know who has been vaccinated in the city and what parts of the city have been reached already? Are there pockets where people are not coming to get the vaccine?
So yes, the problem is it's not a complete list because what we're finding, not everyone answers a lot of the questions on the form.
Mm-hmm.
So the demographics we have are all in VAMs and also with the state. The state has a report that they have on their website that I can also share. I think they do a weekly report of with data, how every town is doing and how many vaccinations, what percentage of the population has been vaccinated.
Is that like is it like WIN or something like that? I can't remember the acronym for it because we get that download dump into Epic at Yale, and we have a whole dashboard about like who's been vaccinated, who's not been vaccinated. Well, not who's not been vaccinated, who has been
No,
vaccinated. I think it's like WIN or Wix or something like that. I can't think of it. Can you?
Wiz,
CT Wiz.
CT Wiz.
Yeah.
Yeah, that's the immunization program. So what we get it from the state website, or we get emailed a report, but I haven't actually received one in the past 2 weeks. So
With just the numbers?
with our data. Here's the issue that we're having. I know that there are people in the community who have not received vaccine that want it, but there are also people who don't want it. And what I'd like to do is spend time with those people who say they don't want it or are afraid or don't know enough about it to be able to educate them. And one of the things we're trying to do is I have an intern who's trying to go into some churches with education materials.
I guess.
But go ahead.
I guess the way I'm thinking about it, and I hear you, and I definitely agree that needs to be done. There's definitely a need for that. But in addition to that, I wonder if we have the ability to kind of look at the areas where there's a low vaccination rate, because you won't really know why someone didn't come. You just know they didn't, or they don't appear to have been vaccinated. So you don't necessarily know why they didn't get vaccinated. So you don't know whether it's an issue with transportation or whether it's just vaccine hesitancy or what the challenges might be. And so that's why I was looking, and I know in the Black community, in the Black and Brown community, there is vaccine hesitation. And I'm just wondering if there are pockets of areas in the community where we can target interventions to get at them. You can go to the churches. Some people you'll see there's others you may have to use a different approach. And so that's why I was asking about the demographic details and maybe, where in the community we could focus our efforts.
No, I agree. The data they send, I'm not quite sure it has. I'd like to see neighborhoods, almost like a GIS system where we can put in points and as people are vaccinated, like we did for COVID cases. And that's something we could look at doing.
Yeah, I mean, and that's I think that's the approach that they take, like in New Haven. I guess the different neighborhoods around, especially around the hospital, and you can kind of target your interventions. And I mean, I hate to even say that it's only Black and Brown people that are hesitant, because I know quite a few people white that are hesitant as well. And I think that we could really and I think we could really focus our efforts on neighborhoods and resources, because some neighborhoods are probably better equipped with even public transportation. Might that be a challenge? Might there be reasons why other than just that they're not getting to the places to get? And not to mention that we're not really doing a great job of communicating where you can go and get the vaccine either, because I know plenty of people that are like waiting to go get it, but they don't know where to go access it. So there's that. So
I think we need to do a big PR push, to be honest. I actually just started one of the other hats that I wear is I'm the vice president of the West Haven Seahawks, as Maureen knows, because she helped us out with that this summer. One of the things we started was this week with our coaches and our board members, and we're going to try to encourage some parents to participate as well as we move along, is why I got vaccinated. So we get a picture of them, and then they send me a little blurb on why they got vaccinated. I think people one of the biggest problems, I think, and listen, I'm totally speaking from like secondhand information and what I've read. Obviously, I'm not a part of the Black and Brown community. Kathy clearly is, and May could speak to it much better. But what I think is, I want to hear from someone I trust that why they got vaccinated. Like, they don't want to hear from me. If I don't know them, they don't want to hear Nurse Kebby. They might want to hear Coach Kebby because they know me as Coach Kebby. They want to see Coach Rick, one of our long-standing coaches. He got vaccinated. Why did he get vaccinated? And to make people feel more comfortable with, all right, so maybe this is something I want to do. And I think the why I got vaccinated helps people realize like what they want to get back to, because everyone keeps saying like, I want to get back to normal. So, one of my coaches said, I got vaccinated for my cheerleaders. I got vaccinated because I want to go to cheer competition. I got vaccinated because I want to go to happy hour, like silly things. But, in the big picture, it's something people could relate to. So I don't think it would be a bad idea for city officials and community leaders to be involved in something like that on the city's webpage and or Facebook page.
Well, I also think it would be good too to have members of the community share why they got vaccinated, and not necessarily be like a nurse or anybody that's like because I think people will do what like this person got vaccinated, they're still here and doing well. And you know what I mean?
Yeah.
It must be safe because, she did it or he did it or whatever. I always try to talk to people about the fact that, you don't want COVID. It's, you know what I mean? It's not even just about like, getting back to your normal life. It's like you don't want COVID because there's all these other things that it can do to you, even if you live through it, which there's so many people that died from it. But even if you live through it, it could change your life. And you don't want it. You don't ever want to get it. And so, and if you do get it, you don't want the worst case scenario, up and until death, So that's the reason why, I try to kind of convince people, and I'm still working on family members,
Same.
I agree. So I had wanted to do a PSA for mask wearing, but I think, Milford, a couple of towns did similar PSAs, and I had been in touch with, I forget her name, at the high school, and who was going to have students help out with, because I wanted some young kids, I wanted people of all ages and colors and races to just do a, reason why they want to wear, they should wear a mask. For example, I want to go back to school, or I want to play sports, kind of like what Kebby was just saying.
Yeah.
But I think now that timing is everything. Now that we're still wearing masks, CDC is telling us now that if we're vaccinated and our friends are, we can gather without masks. I'm not going to. Yeah, that makes me a little nervous right now. I think when you say that gives people might take that and run with it. We're really not ready for that. But I'm not the CDC. I'm just Maureen Wilson.
I think they're overestimating the level of responsibility that comes along with that.
Yes. So, I think what you're saying is brilliant here. I think putting together a PSA, kind of montage of people, photos of, why they want to be vaccinated. What do they hope to, I want to see my grandchildren. There has been in the past year, I've seen all kinds of scenarios, and the devastation and the loss has been unreal, and at times hard to fathom.
And you see the relief just doing the vaccination clinics. You see the relief on some of the people who come in and get vaccinated, and the tears, and just like, I can see my grandchildren. I can, they really do tell those stories.
It's funny. It's like that sticker is like a medal.
Yeah.
Right? Like, because I volunteered at the Yale clinics a few times, and honestly, it's probably the best job that I've done so far working for Yale. I loved it. I wasn't sure I was going to, but I loved it. The people are so happy and they're so relieved, and I just wish we could, I think we really need to, I don't want to wish, I want to make sure that we get more people, get more needles in arms.
I agree
I
completely.
agree, and I've loved every minute of the clinics. It has been the best thing I've done too in the past year. It's been the most
100%
rewarding.
agree. I've said that to Maureen when I'm
Yes.
there. I'm like, this is why I'm a nurse. This is,
Mhm.
making a difference and, helping somebody get back what they haven't been able to do.
How is your, oh, sorry, Heather.
Well, I was just going to add, one of the other things Maureen and I had spoken about earlier is, when we go back to talking, getting into the community, it's almost like at some point there needs to be like boots on the ground, like talking to people, just getting out there, knocking on doors, giving education somehow. I just don't know how to make it so it's, received well, because we just don't know who doesn't have phones, who doesn't have technology, who doesn't have family who can sign them up. I mean, the senior centers know some and nursing agencies know some, but there are people who need help getting,
And I think maybe, wheat may also be a good
that's,
agency to include,
yeah.
What about the home care agencies
Well,
in town that service this area? Have you been
So
in
I
contact with
received
any
a
of them?
communication from a VNA agency yesterday,
Hamden one,
reaching
right?
out,
Was
that I will respond to see what they can provide for assistance. What we need here is, in order to do this, we need resources, because I know our staff is very much stretched, and we've had a wonderful group of vaccinators that show up every week. That we try not to. We also realize people have other jobs, and we don't want to burn out. So we're constantly trying to find new vaccinators and new staff to help with this effort, because it's a huge effort and it requires a lot of resources.
Who updates your Facebook for you, Maureen?
So Mike Walsh posts. I have a health educator who also works with him. She's part-time.
Because I think that I've worked with a lot of volunteer nurses at the Yale clinics that were looking to pick up more hours. One's a school nurse at Pagels. There's also some retired physicians in the area that we're looking to do. We have so many, I don't want to say like we're overstaffed at Yale, but we have so many people that, are being pulled in to do this, that I think we need to leverage our social media account to say, if you're a vaccinator, we need you, and we need to have a schedule of, I'm sure you do, have a schedule out for the next 2 months of when our clinics are going to be, and a way for them to contact you, and that should get posted every day on the Facebook page, as well as the number for the folks to call up and schedule their appointments. How are you doing with doses? Like, are you getting the doses that you need? It seems to me like for our ordering, like the more doses we give, the more they're giving us.
Not us. So local health departments are provided a base allocation of 100 doses a week.
Okay.
I've asked for up to 500. I never get. The most I've received is 200.
Okay. But you always ask for more.
What I do is if I have a population that needs to get done, I call Yale West and they will reserve slots for us.
So I guess Tabby's point that she was making was about the resources that we have at Yale. They outsourced their sign up for vaccinators, and I was wondering if that's what you use to kind of attract the resources that you need, or is it just solely like on a voluntary basis and word of mouth kind of thing? Are you connected with any resources?
No, the latter. So, we had at the beginning, when we were looking for vaccinators and nurses, I had called an agency who would have, vetted and provided nurses. The cost was very high, extremely high, and we didn't have any COVID funding yet.
Okay.
So we did word of mouth, anyone who wanted to help and came forward. And, you know, the governor approved paramedics, dental hygienists to administer anesthesia. So we have some of those on staff. And we've been able to put together a solid crew. And we have, I think nine, the number is 9 paramedics who are currently being, going through their extra training that CDC, our Yukon site, because we have a second West Haven Board of Ed clinic on Monday. And, you know, we will need to fill the vaccinator slots.
So I think I may be able to get people to help if you're looking for more, and I guess so.
Yes, I'm always, yes, that would be wonderful.
And I
And also at the Floyd Little Center, they had one of the days I was there, a class of student nurses and their instructor come and vaccinate all day.
Mhm.
So, and there's so many schools of nursing, there's actually hard for them to find slots to do clinical practice. You know, they have one at UB, one at Quinnipiac, one at Southern. There's also licensed practical, I think, nursing schools. I think LPNs can give injections, right?
Yeah.
Not IV. Yeah.
Can't give IV.
So that might be a resource that you want to think about reaching out to the to those school departments.
Stone Academies even that do LPN stuff.
Oh, right
They're
over
right in
by-
West Haven.
Yeah, right over by Texas Roadhouse.
You could
That
have
might be a
set
good resource for, you
Right.
know, a specific day. You know, obviously they won't be an ongoing thing, but and I would also speak to Neil about sending a message out to the school nurses, because one of the ones that I worked with at Yale West was a school nurse at Pagels, and she volunteered a day at Yale West.
Did you say that the volunteers are paid or unpaid?
Well,
That like,
you mean here with West Haven?
yeah.
So some are volunteering and some are being paid. And I think that I feel it should be consistent, but it really depends on what a person.
Is there choice though? Like if so and so says, okay, I'm going to come and volunteer for the day, do they choose to get paid or choose to volunteer?
They do.
Okay, because I mean, I can just tell you that, like, because I work in an outpatient clinic and all of my coworkers basically are off on the weekends, there's not one weekend that, like, I mean, last weekend, I think 7 or 8 of my coworkers was at one of the clinics giving injections. And so there's like this sign up, there's a computer sign up thing where you have to, sometimes you get waitlisted just to be able to vaccinate. So I feel like if we were able to get the message out, even myself passing it along to the people that I work with, knowing that this is another opportunity to be able to sign up and put shots in arms, I think we can get a lot more people.
Right, that's
Especially
what I was
they're doing the
asking about
4-hour
whether or not
blocks.
she's connected to that at Yale, because it sounds like what Maureen is saying is they're not connected to that setup that Yale has.
Right.
That's getting people paid, because I know even the Southern Connecticut Black Nurses Association, which I was gonna, kind of bring up here, because trying to reach the black and brown community, who's better than to have that chapter, kind of be involved in this work. Many of those folks have already gone through that training and could potentially volunteer, but I wonder if there's a way that we can connect to the hospital and that resource. Are you saying that you've already looked at that and it costs too much money, or is it something that we would benefit from looking at to see what the options are for West Haven?
Oh, I think anything's worth looking at,
Okay.
Yeah.
Because a lot of them are already signed up. I say them, us, and I haven't signed up yet. But a lot of them have signed up already and are vaccinating in the community just to be a presence, in communities as, color. And I just haven't gotten around to it. I fully planned to become a vaccinator, but obviously my situation is a little, kind of strained right now because of, the loss of my husband. So I'm just getting back into the swing of things here, and we'll definitely be, on board to go into any of the communities and kind of talk about it.
Did you say the loss of your husband?
Yeah, my husband passed on the 24th of January from COVID.
Oh my
Oh
gosh,
my
I'm
gosh,
so
I'm
sorry.
so sorry.
Catherine, I didn't know that.
I had no idea.
Yeah,
I'm so very sorry, Catherine.
yeah, thank you. So that's why I'm kind of like, taking a back seat on a lot of things, and I'm kind of like, kind of slowly kind of easing back into things. But it's kind of, it's important, I think, for me to kind of talk, because a lot of people, especially in West Haven, they know me, or knew my husband, or knew us both. And, he's from New Haven. So I think, sharing our story is probably important, but
For
I
sure.
also have to be in condition to
Absolutely.
be able to share the story. And I don't want to make it like, I don't want to be waterworks, trying to talk about it. So, but I think it's an important story to tell, because I mean, people that talk about not wanting to get vaccinated, it's like, if only he had a chance to have been vaccinated, he might still be here, So, so I mean, I do that like on an individual basis with people, and kind of, but again, it's got to be their decision. It can't be me saying, oh, you got to do it. People just have to kind of come to that on their own. So, because you got to live with the outcome. Because again, we don't know what this is like. This is literally an experiment that we're all taking part in.
Right.
Because we don't know what this data is going to look like a year from now, what
Correct.
we're all going to be experiencing a year from now, having been vaccinated without any data to tell us what the long-term effects are going to be. So that's the reason why when people make suggestions that you go out there and you tell people they need to be vaccinated, you got to be careful, because you can do that, but we don't know the other side of the story yet. And you also don't want to be the people that then 5 years from now, we don't trust the nurses either, because
Yeah.
Right.
you
Right.
told us to go get vaccinated, and now look at us. We don't want to be that.
But
So
I
you just,
think at least bring the education to them, bring the stories to them,
yeah.
because they may not have access to it.
Mhm.
And so that's the approach
Wow.
that I've taken. Like even my son, he's like, last night I went down to see him at the gym, and he's like, oh, I'm kind of waiting on the vaccine. And I'm like, Cam, you already know the story. You know what the story is. You know how it can end. He's like, yeah. And I said, so, I did it. My daughter, who's a nurse, she did it. My other daughter's a teacher, she did it. So it's kind of like, so far we're good. you know. But he's got to kind of decide for himself, and so.
I also think too, sometimes it's helpful for people to know people's reactions, because a lot of pushback that I've received from even patients is that, well, everybody gets sick, or I don't know how I'm going to feel, or whatever. And the more that I present to them how A, B, C, and D did this and we're okay, then they're more apt to
Right.
say, okay, well then maybe it'll be okay if I take it too.
Yeah.
Mhm.
And I know we do a lot of that at the vaccination clinic too. I mean, they're already there, but they're so trepidatious and like, I don't know, what are the side effects going to be? And, say, I got it. My arm was sore. It was okay. These things can happen, but these are the most common things. And, don't, you know, don't focus on, not don't focus on it, but these are just could happen. It doesn't necessarily mean it's going to happen. So just, I don't know, education, education, education,
Hmm.
and let
Maureen,
them do what they can with it. Yeah. Go ahead. Sorry.
That's okay. I'm sorry. I didn't mean to interrupt. Maureen,
No,
how are you following up on second doses? Are they getting a second dose appointment when they get their first vaccine?
Yes.
Great.
Because when this first started, I was hearing all kinds of horror stories about people who got their first dose, had to go back into vans, and really struggled to get one. So that's why we decided to just opt for the third-party system, where we just under fact sheet we put the next date and time. We usually give them an appointment for 28 days, and they give them the same time as their first dose, so it keeps it easy and clean.
Hmm. So is someone taking minutes?
I am trying. No.
Okay.
Yeah.
I think we have 10, 15 minutes left, right? Maybe we should, Heather, I don't mean to jump in your
no. I
shoes.
told you
I apologize.
I can
Just
give you guidance because
we
I'm
talked a
learning.
lot. And, I think that was good for the first meeting. We talked a lot about what we think should go on, but I don't want to leave Maureen with like a whole nebulous, what am I supposed to do next kind of thing, or what are they expecting me to
That's
do
what I
next?
was gonna say. That's why I was asking. Like,
Action items. Yep.
I'm trying to
Same
write
page,
down like 4
Tucker,
things.
same page.
Yeah, I wrote down like 4 things, and I'm like, but I didn't know if we wanted to decide on whether or not that's like a credible action item. So
Yep. I think it's a good idea.
I would like to just suggest, talking about the education and the volunteers and how we can support that.
Yep.
Okay.
So can I suggest maybe that if we're gonna think about launching an educational campaign, obviously in short order, because when is our next meeting? What is it? 2 weeks from now? Or are we doing monthly? We're doing 2 weeks.
Monthly.
We're monthly. So if we talk about it today, by the time we talk again, it'll be a month from now.
Mhm.
And I feel like we have to have a shorter course of action if we're going to bring up items to take action on. So we're talking about education. If we wanted to have an education campaign, could we do it by neighborhood?
I agree. That's how it should be.
Sure.
Okay.
Agreed.
So will we get, and who will be responsible? Maureen, would that be you for getting us the data for neighborhoods? Would you do that?
Yes, the only problem is I don't know that I could do that quickly because there isn't a lot of data by neighborhood.
Mm.
I'd have to go through, I'd go through VAMs and pull up. So I guess I don't know how to do that in VAMs, but I know who we have vaccinated. We can pull up our clinics, but now anyone vaccinated through Yale West, through Walgreens, that's a different story. And I'd have to think about how to get that by neighborhood.
Have access
The
to seats.
hospital could help with that.
Sorry, I didn't hear you.
I was
Yeah.
saying if there are resources that might be able to help at either the hospital or at the state level that can help with that, because I mean,
State has all the data and they provide reports.
mhm.
Is there a way we can access somebody there that can sort of help guide us into where we can pull that from, where we can get it?
Yeah, because we need actionable data. You know what I mean? You need data to be able to drive your initiatives. Like whatever we're going to plan, really can't do it without data, right? And so
No. I wonder if we have access to CT Wiz. I have to honestly have to think about it and figure out. I don't know who at the state even. I can contact the folks who provide the data list and see if they could narrow it down a bit for us.
So I think we should start with like steps of actionable items. So the first thing that I think the action item for you, Maureen, is to contact someone at the state and find out if it's possible for you to get a data dump of patients who in West Haven who have been vaccinated. That includes their address. So then you'll know who has been vaccinated. And then you can see if there's neighborhoods where the vaccination rate is low, because the age population is probably going to be standard across the city. Like every neighborhood has some older people, some younger people. So the age isn't going to really matter that much. But if you can get a list of names and addresses of West Haven residents who have been vaccinated, which should be available to you as the Director of Health via CT Wiz. I don't know how you would get it out. I don't actually work directly with CT Wiz, but I know we get the dump into our system. So I'm sure you would be able to get either a spreadsheet or some kind of, information from there if you were able to contact somebody from there. I think the second thing that has to be done is we need to launch, although social media is not that popular with elderly populations, it is popular with the ages of folks that are being targeted or just opened up to now. And that might be a way for them to work on their grandmother or their mother and say, hey, look, I saw on, the West Haven Facebook page that they're having vaccine clinic on Saturday. Let's get you signed up. So I think that information, that would probably be something that, I don't know if we need to talk to Michael Walsh or if it's something that you would want to do to say, like, listen, we need that data posted every day. Just because, once it gets posted, it's there. People aren't going to scroll through and look for it. You want a repeat commercial, so to speak, to drive people to us. And the same thing for volunteer vaccinators, because I do think there's a large group of people that if they knew that you were looking for folks, they would be willing to volunteer. Especially we have tons of volunteers at Yale that are choosing not to be paid, that work a 4-hour block. They come in, they do their 4 hours, and they leave.
Yeah.
I think those three things are like the top three. I think Kathy had another one too, though. She said 4.
Yeah, I was gonna, well, to finish the point that you were making, I was thinking, you talked about social media, but one of the other things is either a news clip on like the morning news shows that people watch, Channel 8 or whatever, and or the 5 o'clock shows. You might be able to get a special spot that can highlight the effort that we're kind of kicking off, and we can really speak to the campaign that we're launching so that people could then look for it. And then
Michael should have contacts for that.
Yes.
the other thing I was thinking of was also the radio stations and having the radio stations kind of broadcast. So if we were going to set up in a specific neighborhood or two, you can have vaccinators in a specific location, and you can have them kind of broadcast that, the city of West Haven is doing vaccinations and blah, blah, blah. This is where you sign up, da, 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 whatever it is. I know you want to keep it to the West Haven residents and access for them to come and get the vaccines. So that's a consideration as we think through that. But, um, you know, that's one approach, because I know people do listen to the radio stations, and like the Black and brown community, especially on a Saturday, will be listening to WYBC, and the Yale's radio station, so they can get on there and kind of broadcast where you're going to be, and then that would increase the likelihood that people could show up.
And that's something
Ken Carney would probably put something in The Voice too.
Yep, The Voice, he would.
But I think if you had like a list of what your upcoming clinics are that you have open appointments for, and the number they can call to schedule that appointment.
You're saying that VAMS website, and I might be saying it wrong, but that website is the site to sign up on, but you've closed it so you sign people up. They call and you sign.
Yeah, anyone can go into VAMS, create an account, and find a place, find an appointment anywhere, in the state. But we opened it one time, and what happened was
You crashed the site.
it was supposed to be for second dose clinic for 200 people who had received their first dose with us in February. We opened it, told everyone when to go on, and it filled up with people who needed Pfizer, who needed a first dose, and so we had to, call them all.
Which vaccines do you have at the moment? Are you have all 3?
We have Moderna. We don't have Pfizer. We have Moderna. We ordered Johnson & Johnson today. We'll see if we get any.
I think the Johnson & Johnson would be good for the shut-in.
Yeah.
Yep.
And a mobile, maybe you do like a pop-up clinics. I don't know what the rules are regarding that. You know what I mean? Like,
right. Yeah. Well, that's in fact Heather and I discussed that today. Johnson & Johnson would be perfect for Homebound because it's one dose. And
the hospital advertised it in the New Haven communities. They were going into people's homes to deliver the vaccine while in the home, that's another thought too for the homebound population that you're thinking of. Maybe just having a visiting nursing group just kind of go in and administer the doses. I was wondering if there are mobile vans that we could benefit from borrowing from. I have access to resources at the hospital, and that's why I'm asking and I'm invoking hospital because they've offered to be a help to us and have said let us know how we can help or what we can if it's reasonable and they can accommodate. I'm sure that they would.
Because I thought the same about Bridges too.
You
Bridges
know,
has that van.
yeah, so if we can get a van, you can
Mhm.
kind of pull up in any neighborhood, but then that brings to the issue is the refrigeration at that point, you know,
Mhm.
because you have to pull
Well,
them out.
we have a vehicle that our emergency management director purchased, and it's what they'd be using. And one of the we also have to consider how we would transport it. Do we want everything drawn? Do we want to take it out? We have a medical grade cooler, a digital data logger, and we need someone to monitor that,
Okay.
during the trip. And I think honestly, it's important to have a nurse on board.
Mm-hmm.
Yeah, because you got to monitor the reaction monitoring.
Right.
And what who's doing your diluting?
We don't have to do that with.
Oh, you don't have the doses you get or not?
No, with
Okay.
no, not with Moderna. No.
That's the Pfizer, the 0.3 and the
Yeah.
dilution. And so
Well,
I would say the action items then would be we got to figure out how to get the data, first of all, and then start from the data, develop the education. Should we meet in 2 weeks rather than a month, would you say, or
I kind of feel like we should.
We can add on a special meeting. It
special
doesn't have to
meeting?
be
Yeah.
a standing meeting. Yeah, you can have a special meeting anytime you want.
I thought when she scheduled this, when we talked about this at the opening meeting, we made it so that you wouldn't have to do that. Because didn't we send
So
it?
I
We did
think we decided
schedule.
not to cancel. So we didn't cancel anything, but we can add them on. So
Yep.
it wouldn't be as much of a problem canceling. So
Okay.
I think we should maybe consider adding 2 weeks from today.
Yeah, you can add on a special meeting at any time as long as you notice it with the city clerk. So tomorrow, make sure you let the city clerk know so that she'll notice the meeting for you. The problem with scheduling them every 2 weeks out is that then when you cancel them, you get a lot of blowback from people like, we're in the middle of a pandemic. Why are you canceling meetings? And we just may not have anything that we need to meet about. Obviously, the work is still continuing in Maureen's office, but the appearance of not having a meeting makes it seem like,
Yeah.
we're kind of just like whatever. But adding on a meeting, you can do it. You can add on a meeting every week if you want. You could add on a meeting every day.
I mean, we can certainly meet again in a week and regroup. I'm definitely not against that. I mean, whatever anyone feels we should do.
Well,
I
Maureen,
think
that's up to you because I think.
Well, I think that a week might be soon. I have a lot of clinics between now and then. So I honestly don't know, realistically don't know if I can get all the data and the information I need in a week.
Yeah,
Is
we
it
gave you a lot of asks
Try.
for 1 week.
Is it something that's only accessible to you and your role, or is it something that we might be able to kind of get access to?
I don't know. I'm sure if anyone can contact the state as the board and say, or I can assign it to somebody. That thing is, we are very, limited for staff, and anyone I assign it to is working in clinics. So, yeah.
I can touch base with you tomorrow, Maureen, and
Okay.
maybe see if we can work that out. Since I'm going to be with you anyway tomorrow at the clinic.
I don't see why they wouldn't be able to give, even the mayor's office or.
Yeah. And I mean, even, I don't know, like, our offices too have a lot of information,
Mhm.
and I may be able to get my hands on it as well. So
Okay.
I'll see what I can find, and,
Okay.
and you guys can do the same. As long as it's coming from the state, I think that's what we're after, right?
Right. So are we the 23rd at 6:30? And between now and then, we'll gather the data and maybe gather some ideas as to what we're going to try to get out there. And then with the data and what we're going to try to get out there, we'll be able to talk about, we'll each get our ideas of kind of what we want to bring out to the community and then where we're going to head with the data.
Right.
23rd.
What is the date in 2 weeks?
The
The
23rd.
23rd, right?
Yeah.
So 6:30?
Okay.
Is that enough notice, Kebby? Do you know? 2 weeks?
Yeah,
Okay.
I think it's 7 days.
Okay.
But Patty, if you call Patty, she can tell you how long it is. But I
Okay.
think it's 7 days.
Okay. And then we'll just, I mean, can we all maybe do a little bit of information gathering too on our own? And
Yeah.
Just working in IT, I just caution you to be careful about what information that you obtain from other sources. We get a data dump on our patients that we have vaccinated. I'm not sure if we have the same level of access that Maureen has as the health director of the city
the city.
versus a hospital entity. Like, we don't get everybody in New Haven's vaccine status. We get our patients' status.
I would
Been
never be
vaccinated.
asking from the
And I know you wouldn't. I just wanted to make sure that I got that on the record in case
Yeah.
anyone's watching the meeting on YouTube, that we are not accessing any data.
Never
No,
would do that, and I certainly wouldn't do anything without permission. So
Yeah, I totally know you wouldn't. I just want to make sure everyone
Out in
listening
public.
is aware. Yeah.
All right. So should we adjourn for now and then regroup on the 23rd?
Sounds good.
All right. Motion to adjourn at 7:33.
Okay.
Kebby and
All
Kathy.
right.
All in
Thank you
favor.
for your time.
Thank you all.
All in
Thank you
favor.
very much.
Aye.
Appreciate your
Thanks,
time.
thanks, Maureen.
Talk to you soon. Bye-bye.
Bob, Heather.
Thank you. How do I get out?
We're the